and welcome to the HerFlow podcast. I'm Saahithi, your host and founder of HerFlow, a team-built app created to help girls track their periods, understand their bodies, and feel confident in their health journey. At HerFlow, we believe that no girl should feel lost or confused about their first period. In today's episode, we'll be talking about first periods and puberty, and what every teen should know with Dr. Tripura Sundari, a renowned gynecologist and senior consultant gynecologist at Kim's Hospital with more than 42 years of experience in the field. Welcome, Dr. Sundari.
Hello, Saahithi. I'm happy with you.
Thank you so much for joining us today on the show. Let's start with our first question of the day, the basics. What actually happens in a girl's body during puberty, and why is it such an important stage?
The cute baby who is born slowly grows. When she is born itself, she'll having small 2 ovaries and they'll be having multiple ova. That is for eggs. They will not increase further. They keep on growing. Once the baby grows up to usually 10 or 12 years, the hormone changes and more of ova in the ovary increase and one of them will release. That will cause a hormonal change. So that change from the brain to the ovary to the uterus is called hypothalamo-ovarian axis. With that, when the hormones are started and released, she'll have a bleeding from her uterus through the vagina. That is called the first bleeding. So that indicates that she is now a girl, not more a girl. She's now a woman, and that starts her happy reproductive period. So that only shows that all her system is good and she is getting her periods, and that's the time when she is blooming into a beautiful.
Wow, thank you so much. It's so interesting to know what's really happening in the biology of a woman's reproductive system. One big moment during puberty, as you mentioned, is the first period. It can be a confusing moment for many girls. Could you please explain what exactly girls should expect when it comes to their first period, and what can be normal and what is not?
The first period is always a welcoming period. In some areas of the world, they celebrate it very grandly as if it is something like a marriage, with saying that the girl has bloomed and she is going to be a beautiful girl. The thing that happens in the first period is, as I told you before, she'll be having little amount of bleeding, and that bleeding signifies that the hypothalamo-pituitary ovarian axis is normal, and it is a normal physiological process. As the moment baby is born, she cries. At the 8th month or 9th month, she crawls, and at 1 year she starts walking. Similarly, at the age of 10 or 12, the child starts having bleeding. It is a simple, normal procedure. Some people highlight it. Usually this happens around 10 to 12 years of age, because of the hormonal changes that occur. The child will have a change in her face, she'll have breast development, she'll have excess hair in the armpits and in the pubic area, and she will be developing all other changes that usually starts 6 months to 1 year before she gets her first period. That is called puberty. When she first gets the bleeding, she is called the first flow, is called the menarche. This menarche usually, as I told you, start between 10 to 12 years. But if it is very early, say before 9 years, it is called premature menarche. And sometimes, to bad luck, it doesn't start till 18 or 19 years. And when the child doesn't get her first period before 18 years, it is something abnormal. You have to evaluate whether she is having hormonal imbalance, or whether she is absent uterus, absent vagina, or some other problem is there, or she is not a girl. She could be kind of chromosomally a boy or a mixed boy or girl. So we had to do chromosome analysis also. So a healthy girl usually gets a period around 10 to 12 years, and maximum is 14 years is normal. Any bleeding that is either before 9 or after 16 is abnormal. So it's a welcoming thing, and the child should be prepared for it both mentally and physically, so that she doesn't have it as a surprise.
Yes. Thank you so much for explaining to that. And on the topic of mental and physical strength, I know from my own experience that having your first period and menstruating for the first time can be very overwhelming, especially for teenagers and considering that they'll be undergoing so many hormonal changes. From your experience, what advice do you have for teenage girls who might feel scared or embarrassed or even confused about menstruating for the first time?
That's a good question, Saahithi. The children all keep seeing the others And now that so much of internet and the WhatsApp is all available, and they are getting confused, they are getting wrong information, and some children are getting diverted also. So this change that occurs around 10 to 12 years should have been directly told to the children, especially in the school health education, about what are the changes, what are the dangers, how you keep yourself clean, and how you keep hygienically normal, so that you don't develop other problems. For example, if the bleeding is there, it can be a surprise. Probably you had your horse cycle when you were at home. This can happen when you are in a tour, or it can happen in the school. Then they're embarrassed. So these children around the time of 9 to 10 years should be informed that such a thing can happen anytime. That is a pleasant thing that will be going on. Nothing to get scared. And some children even start crying that something they got hurt. No. So if they are well informed and they are told that such things can happen, it's a pleasant thing, a welcoming thing, and it will not be a surprise. Children will not be embarrassed, and children will not. When the colleague students, the pure children are there, also will try to help them and will not laugh at them. And at the same time, keeping hygiene. Importance is hygiene, how they should change the pads, how they should keep themselves clean, and the way they should handle themselves is very important, because if the infection gets up because they don't change the pads for a longer period, or they keep going for missing washrooms at an unhealthy period, once the infection starts, this will be there lifelong. That will affect their uterine infection, that will have tubal infection, in future having children or having ectopic pregnancy. All this will be sequelae of having unhealthy habits during periods. So the periods should be welcome, and children should be informed not only about what happens, and also another important thing is, especially when children are exposed to so much of internet knowledge, the sex. The sex is also an important thing. Children should be informed, because there is a chance of getting infection, and not only infection, unwanted pregnancy, and you try to take tablets for that without telling the patient, parents or the teachers, then it can lead to even health hazard and even death. So the children should be informed how they should keep themselves not only clean during periods, how they should protect themselves from the sexual hazards.
Wow, thank you so much. And I think I can definitely reflect a lot upon that. I have been very privileged myself to grow up in a community where friends and family have been open about menstruating and having your first period. And on your point of exchanging those experiences, I think being able to openly discuss period experiences and how to manage your period has definitely brought upon a lot of emotional strength in this community of girls. Because as you mentioned, being able to speak about it and knowing what it even is to have your first period really brings a lot of strength in young girls. So thank you for that. And on this topic of supporting and preparing teenage girls, what advice do you have for parents and teachers? We have a lot of listeners who are parents and teachers. How can they best prepare as the adults in a young girl's life to guide them through this stage of menstruating?
Yes, that's a good question, a very important question. What I tell as I've already told you, that keeping children informed that a change can occur to them. Because usually, as I told you, this starts at least 6 months to 1 year before they get the first period. So as they increase in size of the breasts or change in the facial shape or getting hair, yes, you know that this child is now getting prepared for puberty. From this is prepared, puberty can end up in the first period. So these children should be informed, and lots of taboos are attached to it. In some communities, they say you should not go to temple, you should not go outside at all, and then some countries, they even have the children just all 3 days made to sit at home and not even have a bath and not to talk to anybody. So these are all wrong things. You see, they are going to temple or going to church is your wish, but it is a natural process. As you have eat, drink, urine, pass urine, it's also something like that only. About hygiene is very important, and keeping a taboo. See, not having bath for 3 days is a very wrong thing, because I told you it causes lots of infection. So teachers and the parents should know that they should educate their children. It's always better you have bath twice a day those 3 or 4 days, so that they will. So with that, they should have at least hot water bath twice a day. clean themselves, clean this thing, change the diapers very frequently, and not get scared. And if you don't get period for 2 to 3 days, just following the first period is nothing wrong. Because as a child, as told you, will try to crawl, walk 2 steps, fall down. Again, you'll wait for 2 3 days, again start like that only. These periods, once they start, they may have regular periods continuously, or they may have a period for 1 or 2 days. Again, they may not have period for 4 5 months also, or they may have keep on having small spotting for 3 4 months. But the main thing as doctors we say is not to get bothered. Usually they give hematinics or healthy food, they recover, and not to give any hormones, because if you give hormones at that stage, the height of the child will be suppressed because the bones get solidified and they won't grow further. And not only that, this doesn't need anything, it gets affected on its own. So the parents should not be panicky. There's no need to run for the doctor unless if the bleeding is very heavy and they are becoming anemic. Otherwise, a good diet and maximum you can give this thing, tranexamic acid, that will usually correct, and the children will set right within 6 months to 1 year to regular periods. At that stage, you are more prone to put on weight. The children can very obese, and if they become obese, they again get pimples, they get unwanted hair. So this period of transition is very important to give healthy diet, low calorie, high protein diet, and good exercise. And they should encourage the children go out and play, and they totally have good bath, keep themselves hygienically good, so that the children will become confident and they can keep themselves clean. And another important thing which we are saying is between this 9 to 14 years, we are encouraging all children to have a human papilloma virus vaccine. That will prevent cervical, not only cervical cancer, vulval cancer, uterine other cancers, and also oral cancers, not only in girls but also in boys. So that is very important. Just 2 injections at 6 months apart. For children between 9 to 14 is very good and helps them in lifelong, they'll have protection. So these are the things we tell the parents and the teachers to encourage the children, to educate the children, and also protect the children from long-term infections and cancers. So telling the children about the hygiene is very important. Not only for local thing, but as I told you, it will cause long-term infections in the pelvis that will affect their future life. So these things should be informed to the children and they should be taken care of, and vaccination is new.
Oh, wow. Thank you. That was very insightful. So you talked about how teenage girls, especially when they have their first period, can be very prone to infections. So it's incredibly important that they take care of their hygiene. They have warm baths, they change their pads or tampons frequently. I think that is definitely very important advice. And then also you brought up the point of having a healthy diet and a good
vaccination.
Vaccination. On that. What are some aspects of the diet that you would recommend teen girls to have when they're menstruating?
No junk food.
Okay.
See, people say we didn't have a food at all, we didn't do dieting, just we had a Coke and pizza. One Coke will give you 350 calories. A slice of pizza will give you 300 calories. That's equal to 650 calories, which you can have with nice 8 slices of bread. So just imagine you're not dieting. So you are dieting to more of vegetables, more of roughage. Curds you can take better than milk, and do lots of exercise and walking. And as part of the thing, and in that period of when they are almost getting into a stage of getting the menarche, better children are not left behind alone, and they are not alone sent to a place where they get a period and there's nobody for them to hang on to. So they should be very near to the parents or near the home. And even in the schools, they should have some privacy, and they should have tampons or the pads available, so that the children is there. Have any problem, the teachers should come to their help, rescue them, and tell them they doesn't feel bad, and at the same time they should be informed and they can send them. So just think, this should not be a harmful thing. It should be a pleasant thing, and children should always remember their first period. And as I told you, it's celebrated in a grand way in some places that of course sometimes embarrasses the children, but anyway, it is their own custom. The thing is, it is a pleasant thing and should be happy about it. At the same time, you should educate the child about the hygiene, which is very important.
Yes.
And no junk food, And that's I told you, those are the hormones that are occurring. They tend to put on weight. And when they tend to put on weight, the oily food is there, all the hormones get stuck in the fat. And the fat, when they are stuck, fat has the habit of turning them into male hormones. So the androgenic symptoms which you have will cause pimples, will cause unnecessary hair, and the blackening of the neck, and the upper abdomen fat. That is all causes what is called, everybody is scared of, is PCOS. So this PCOS can be avoided if you take healthy diet with low oily, low high protein, and high fiber diet, and you take plenty of water. Play well. Should always play. Is physical exercise is very important. If not anything, simple walking is good, and don't overeat. As I told you, I tell all my children, it should be either S size or M size. Should never come to L or XXL. Once you come to XL, XXL, it is gone.
Yes.
Okay. Nice that you are concentrating on a very important topic like this. You should educate your children, and wish you good luck.
Definitely. Thank you. So now, and I think given that feedback, I definitely have to remind myself to work out a little bit that time of month, because I enjoy my junk food and sitting in the couch. But for all of our listeners, make sure that you eat some good, healthy food.
You get junk food. You get junk food only when you come first in the class. That should be only like a gift, not a written thing.
Yes.
Eating lots of bread, lots of buns or pizzas and burgers and soft drinks are very injurious to health, and it will cause any injurious even to the ovary. So that ovary, once it's insulted, it gets angry, it turns into PCOS, and all the problems start. So be healthy, take healthy food, do exercise, and be happy.
Yes, and even light walking can pass as exercise if you're not in the mood for something big. And I know you mentioned something very, very important again, which was the hygiene. So many girls keep a little period essential pack in their school backpack or in their bathroom. What would you recommend are some first period essentials, or even in general essential supplies that a girl should have in her little packet in terms of medicines, hygiene, etc.?
See, as far as the pads are concerned, as I told you, in school also they should have, because children are small. They're 9, 10 years. They may have, they may not have, but school should always have some pads in their thing. Nowadays, most of schools, they have dispensers. You just put a coin and you get this thing. So it is not a big, even in airports, even in this thing everywhere. Now, pantry pads are dispensed, so it's not a big problem.
Here in
but another,
the public bathrooms actually have pad and tampon dispensing.
Most even the washrooms also have it. Pad dispenser. That's a very convenient thing. But they may not be available everywhere, especially in places like India. It may not be there. So the teachers should have them, and the parents should educate them and keep one in the bags. Another thing is, in the first 2 periods, one period, there may not be any pain. After third or fourth period, they start getting pain during period. It's called dysmenorrhea. This dysmenorrhea is again, children trying to take an advantage of that and stay back at home. No. If when they have dysmenorrhea, a simple tablet like paracetamol will help. And they should have a very good hot water bath and take a tablet and divert themselves. Within few months, they get used to it. Staying away from school or staying from work or just lying on the bed will only accentuate the pain, but it won't give any relief to the pain. So that is usually by 6 months to 1 year. As maximum 2 years, the pain will subside. And if the pain doesn't subside and the patient is having crucial pain, again, it is a duty of the parents to get her checked by a consultant, because it could be again a cause what is called a endometriosis. That is a condition which again a horrible thing, worse than a cancer. It's not cancer, but worse than a cancer, which makes the children suffer. And if it is neglected, not treated in time, that will go into again whole thing. Big clots will form in the ovaries. They get attached to the tubes. Tubes all become tumors, the tube ovarian masses. The pain will be there. Again, it will affect her quality of life. Not only that, she'll end up in intractable pain and also infertility. So that is a long-term effect of this thing. So children are not getting relieved But as I told you, hot water bath or keeping a hot water bag in the lower abdomen or taking a small paracetamol tablet, if not relieved that, really suffering, always better. The top parents should take them to a consultant, get an ultrasound scan. That will definitely tell if the child is only getting scared or only malingering, or really she is having some problem. But if you just push off saying if she is malingering and really there's a problem is there, the child will suffer in long run. So pain during period is called dysmenorrhea, which is normal. Up to some time, this only starts on the day one, and one day it will go off. But if it is congested dysmenorrhea, as I told you, because of endometriosis, then it will start a day before period, continue throughout the period, and excruciating pain, and that should be evaluated and treated. Then it will be okay. Neglecting that pain is not good.
Okay.
So children should told they'll have pain, they'll have bleeding, which is normal 3 to 4 days, and having pain on the day one is normal, and they having 3 to 4 pads per day is normal. The child is bleeding more than 8 to 9 days, or she changes 78 pads per day, then she should be treated by a consultant.
Okay, thank you. And I think you mentioned using the number of pads as a measurement. And I think that is very, very crucial for girls to know, because especially when you have your first couple periods, it's difficult for girls to understand what level of pain is considered normal and what level of pain could be something that needs to be checked up, right? Because we're not used to menstruating every month, so we can't exactly figure out what the level of pain should be. So I think what you mentioned about how many pads you're going through every day is a wonderful way of kind of measuring your flow, because really being able to track that is what's going to help you go to your doctor and then identify, is your flow too heavy, is it too light, etc. So that was amazing advice. Thank you so much, Dr. Sundari, for sharing such
important information. Wish you good luck.
Wish you good luck. And to every teen listening, remember that your first period is nothing to fear. As Dr. Sundari said, it should be a pleasant experience. It's a sign that your body is completely healthy. It's completely normal. And to all of our parents and teacher listeners, your support makes all the difference. Please, please, please educate your children, reduce the stigma, and invite them to talk about their experiences. Here at HerFlow, our mission is to empower all teenage girls with the tools and knowledge that they deserve, from period tracking to educational resources to a supportive community. You can download the app or learn more about our mission at herflow.org. That's HERFLO.org. And if you would like some more advice from Dr. Tripura Sundari, her contact information will be in our description. Until next time, let's keep embarking on this menstruation journey together. Thank you so much.
Thank you. Good luck.